Good evening, everybody. Welcome. I'm Ryan Yamamoto with the Coalition of Community Health Centers, and it's wonderful to have you here all today. I'm really excited to welcome you all to our first Coffee Connections of 2026, and this one is Leading Boldly in a Shifting Health Equity Landscape. So I think for many of us, as we think about where we are in this moment, a lot of things feel uncertain, inconsequential. I would say here in California, we're definitely seeing definite shifts in political policy, funding environments that really do have an impact on how we talk about health equity, how we invest in it in many cases, whether we're able to advance it at all. For community health centers and other leaders in this room, I think these shifts raise really important questions. How do we continue to advance equity when the language itself is being challenged? How do we remain accountable to the communities we serve while also navigating legal, financial, and political constraints? And what does it mean to lead boldly in these times when I think the path forward seems really unclear for many of us? For those of us joining, and this is your first Coffee Connections, the Coalition of Orange County Community Health Centers is a membership organization that represents community health centers throughout the county, really ones that serve and represent our vulnerable populations. The coalition represents 20 community health centers across the county that serve upwards of 280,000 patients, approximately 840 to 1 million encounters per year. So as you can see, our vulnerable communities do exist in a very small county such as Orange County, where the population is somewhere hovers around 3 million. So almost 1 in 3 individuals are actually on Medicaid. Every day our members, our community health centers in this room and other social service providers really do experience and see firsthand how social and environmental and other economic, I would say, problems or issues impact health equity at its core. I think for us, in this sort of environment that we're in, we just sort of have to give each other grace and just recognize where we're at, and it's okay to feel uncertain. It's okay to feel that we don't quite know what we're doing just yet. Before we begin today, I really want to thank those that are in the room that really made today possible. To all of our attendees, thank you for coming on a Friday afternoon. Do appreciate that. This is a sort of a change up for us. Many of you participated in our Coffee Connections before, have been to them on Friday, but it typically occurs from around 9 o'clock, so typically in the morning before lunch. We decided to, one, change venues, but also the time to see if we could attract or gain or allow for other individuals to participate. So it's great to see new faces here today that we haven't seen before. I really want to thank our speakers today. These are such an incredible group and dynamic group of women that have experience and can speak to today's topic quite well. I would also want to thank our community health centers and our community partners for everything that you do, because you maintain a dedication to community at its core is, something that you hold dearly in your hearts. To our students and our emerging leaders, thank you all for attending. I think this is kind of something of a sort of a transition for many of us. We're trying to think about what does that new crop of leaders look like? What do our new students coming into the workforce need to hear, as well as how they can engage in this space? And then lastly, I really want to thank Coalition staff that have put this event together. We spent a lot of hours putting these events throughout the year, so I just want to thank our staff for the setup and for the content, gathering speakers, and just the arrangement for the day, and also for our technical assistance provider today. So 43 Bridges over there on the corner recording everything. They've been our partners through this since the very first day. Had just been an invaluable partner to us as well as to some of you as well. All right. So today's discussion, as I mentioned earlier, is really about trying to create a trusted space where we all can reflect and have a great dialogue about the subject at hand. We know that advancing health equity has never been simple work. It requires confronting difficult truths, making intentional choices about how we allocate our resources, our time, our staffing, and sometimes taking positions that may feel uncomfortable or politically challenged. I think today we hope to get to a point where we can talk and discuss and examine our current political policy and funding shifts and how they've impacted our communities and how it impacts health disparities at its core. Explore different forms of how we can be bold in this space in our leadership, and then actually be able to hear from these incredible leaders about some changes and strategies that they are employing now to kind of counter this idea of or attack on health equity. I want to say that being bold doesn't always look the same in every community or within every individual or person. I think boldness is speaking up. I think sometimes it's, being quiet and or protecting programs that serve vulnerable communities. I think it's finding new ways to advance equity within the constraints that we're facing. And sometimes boldness is also about knowing when to pause, when to be quiet, when to be strategic, and when to think and protect safety and stability of our organization so you can continue to do the work that you do. And that's a really hard thing to kind of think about and to do, especially for organizations that are, at its core, are advocacy type organizations, always advocating for those that are most vulnerable. I think we really do have a struggle or find challenges in this space. Also, boldness is standing together. So again, thank you for coming today and recognizing that I think together we can all move the field forward. And since the creation of Coffee Connections, for me, what really is a great, or what I believe is a favorite space for myself, just because it brings together a lot of different individuals as well as different leaders and communities together to have these really hard conversations. If you've been tracking where we've gone throughout our past 2 years of doing Coffee Connections, we've had a multitude of different topics that challenge status quo. We're looking at women's health, gun violence, climate change and health, things that are going on with the current administration, and then obviously our conversation today. So I want you to lean into this conversation today if you can. Ask questions. Think internally, how do you show up? How does being bold in this time, what does boldness and equity look like for you? And then how we can support each other moving forward. So with that, I'd like to give an opportunity for our panelists to introduce themselves. So I'll start with Krista on the end, if you would mind telling us a little bit about yourself, please.
There we go. Is this thing on? It is on. Thank you, Ryan. And I just want to thank the Coalition for including Planned Parenthood in this important conversation as well. And thank you all, as Ryan said, for coming out on a Friday afternoon. I'm Krista Hollinger. I'm the president and CEO of the local Planned Parenthood affiliate of Orange and San Bernardino counties. We are one of the largest affiliates in the country by the number of patients that we serve, and used to, for a very long time, be a member organization of the Coalition, and now we're just really good friends too, and participate in a lot of the initiatives as well. I've been in this role since July 1st. I was formerly, though, the Chief Operating Officer for a few years, and prior to that, I know we have UCI in the house here. I was at UCI Medical Center and medical school for 17 years. And just very quick fun fact, I grew up in Tustin, and one of my, I would say one of my first community leadership positions was in high school. I was the first student member of the school board, and we met in this building right over there, and after it had just been built. So it's fun to be back here talking about leadership, like 10 years later.
Thank you. Jeanette, please.
Jeanette Sanipatin. I'm the Director of Policy and Advocacy over at the Coalition for Humane Immigrant Rights. We're one of the largest immigrant rights organizations in the country. I oversee all of CHIRLA's local, state, and federal policy work, as well as our impact litigation team. And I'm just happy to be here. Thank you for inviting me to participate on this panel. It's great to see such a turnout on a Friday night. It's nice and warm, but we're here, at least in a nice air-conditioned space. In terms of leadership, I don't know where to begin. I am also a practicing immigration lawyer. I've practiced immigration law for over 30 years. I think it's difficult, right, to be a leader in this moment, given what we're facing with this current federal administration, especially when cruelty is the point of many of their policies, and many of those policies are being directed to the communities that we all care about the most. For me, I'm a daughter of immigrants, and so this hits home really hard, but I'm really happy to be at an organization that is not only a membership-driven organization, but in spite of being targeted by this administration, we've made the decision to not back down and to continue to fight every day for our community, for our families, for our neighbors, and for the people that we center the work for. And so I think being bold in this moment is really about not backing down in spite of what we're seeing around us on a day-to-day basis.
Thanks, Janet. Hi, everybody. My name is Berta Alicia Guerrero, or B for short. I am the AVP for Government Affairs at Altamed. I've had the privilege of joining Altamed, I think July 8th, so you're my senior, Krista, in this particular role. And prior to my tenure at Altamed, I had the honor of working for then HHS Secretary Javier Becerra at the Department of Health and Human Services, as well as for Congressman Jimmy Gomez, representing downtown Los Angeles. I am a native of Santa Ana, so it is exciting to be back home after 16 years. I went to DC on a 9-month fellowship. I told my parents, I'll see you in 9 months. And then in a blink of an eye, it was 16 years later. And so it's good to be back in Orange County. And in particular at Altamed, Altamed started, it was founded through the civil rights movement. It was at a time when people were having conversations about justice, dignity, access to healthcare, similar to the conversations that we are having today. And, born out of that movement, Altamed has grown to be the largest federally qualified community healthcare center in the country. We serve over 600,000 patients annually, 200,000 of which are here in Orange County. And, we are proud to recently have been awarded one of the greatest places to work. It is a tough designation to get, in particular in the healthcare sector. We're very proud to employ about 1,500 Orange County natives. So thank you.
Thank you, P. So before we dive into the questions, I just wanted to set the stage for us all to the audience today, thinking about health disparities and what are some of these definitions of these words. I think because a lot of times you may have heard them in the past where they're somewhat interchangeable, and they actually really are not. And so in health disparities in the health space, it's really about the metric on what we use to measure and describe differences in health outcomes between different groups of individuals and communities. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. And health equality is simply just equal access for everyone. So that being said, we'll go ahead and we'll talk a little bit today about some of these questions that we have set up for our panelists. They should have really great questions because they've been giving them 2 weeks in advance, just kidding. But you'll find out that these individuals have some really great lived experience in this space. They live it, they breathe it, they think it, they sleep it. And that being said, I'd like you to answer the question, please. So given the recent shifts in local, state, and federal policies and funding, what challenges or opportunities are emerging and impacting your ability to advance health equity? Or, don't point, it's for all of you, but.
Okay, I'll kick us off a little bit. So anyone who's ever met me has never said B is so optimistic. I am not. By nature, I'm the most pessimistic person in the world, and I think there's something to, being the eldest daughter of immigrant parents. And so I would say that in the healthcare landscape, we're at a really pivotal moment. I would say that there are a lot of changes that are coming at the federal level with regards to cuts, and in particular to Medi-Cal or Medicaid that will impact families across the board. And in the state, we do face a structural budget deficit where conversations around cents and dollars impact access or lack thereof for many communities. But today, just for you, because it is a Friday, I am choosing to be an optimist because I have to believe that the arc of justice, although it is long and it bends and it twists and it stretches, it does not break. And we are part of that framework. I think that as we are looking, how do we respond to the changes at the federal level? There are opportunities and fighting chances for us to keep Medi-Cal whole for as many people as possible. So for example, we know that work requirements will be implemented next year. We know that an exception to the work requirement rule is medical frailty. And so through experts and academics thinking through, most of the patients that we serve and that are on Medi-Cal are medically complex, and they have certain, whether it's hypertension, diabetes, you name it. So how can we be creative to create the most generous definition of medical frailty to protect as many people as possible from the work reporting requirements so they can keep their health care? And on the state side, again, the state, depending on who you listen to, it's a $3 billion budget deficit or 18, or somewhere in between. But they're looking at real cuts. And I think for us as a movement, one of the things that we need to convey is that a dollar saved in healthcare today will be paid tenfold tomorrow. And so while, some of the proposed changes, and I'm sure some of my colleagues will talk about that, will close the budget deficit today, that'll create bigger deficits tomorrow. So we have the economic argument. We've made it, but continuing to make those data points.
I think that for immigrants in California, right, we're going to see a lot of cuts, not only from HR 1, but also from our state budget negotiations from last year, right? Last year, we instituted Medi-Cal for undocumented folks for 18 to 55, or that middle group, right? And in order to address last year's budget deficit, the legislature decided to freeze enrollment. And so this year, we're working with our partners on the ground to ensure that there are no more cuts to Medi-Cal this year, that we restore the cuts from last year or unfreeze the freeze, but also look at what are those cuts that we're going to see because of HR 1 and how those are going to impact folks that we used to call people residing under color of law. There's a new term of art that they're using, but it's basically those folks that have protections under U visas of domestic violence victims, and folks who also have different types of visa statuses, like folks that have been paroled, folks from Afghanistan, and folks that have come in with those temporary protected statuses as well. And so this is going to be a big hole that we're going to see in our coverage starting on October 1st. And so we are really trying to push our leadership to really understand not only the history of covering these groups, but understanding what the real implications are. And so we're really pushing leadership in Sacramento to take a second look, to really understand that we need to be bold and push back against these cuts at the federal level, but also ask our governor to really take a stand. He's going to leave. He technically can kick the can down the road. And so we're telling him, you got to do something to cover the communities that are going to be severely impacted by these cuts. And so we have been coordinating, strategizing, and relentless on our messaging that we, as a state, cannot let these cuts go through, because our history in California has demonstrated that we've stepped up to the plate whenever we've seen cuts at the federal level, right? We had big, major cuts to healthcare, to SSI programs back in the 90s. And so California recreated all of these programs for immigrants, and we've come too far to lose all of this right now. And so we're continuing to push, work with our partners, leverage our political power, and call upon our own leadership, but also push the legislature to continue to advance proposals that are going to directly meet the needs of our community at this given moment in time.
So Ryan, you were asking about some political threats to health equity. As you were talking about, Jeanette, this administration, it's all been about cruelty. And I think about sort of at the most foundational level, the political assaults, and I just call them moral assaults on folks, is absolutely leading to equity issues in healthcare. At Planned Parenthood on July 4th, we were defunded, which meant that we were unable to get reimbursed for up to 90% of the bills that we submit for all of our services. Well, across California, 80% of Planned Parenthood patients are on Medicaid or on Medi-Cal. So right there, a defund to us just beyond all of the other cuts in the big, ugly bill that we're talking about, just for our patients. And we provided over 200,000 visits across our 2 counties last year, 130,000 patients that we serve. And when you think just the magnitude of that 80% of them are on Medicaid and we can't get funded for any of the services we provide except abortion. So this defund was specifically so that we would not provide abortion any longer, but that we can get paid for. And the other 93% of services that we provide, we don't get paid for.
Thank you, Krista, for that. When we talk about leading, and I think each of you your organizations has addressed this individually differently. The other thing to this is, people think, oh, this is something new. And actually, we've seen this before, right? So history repeats itself. We've been under fire much like this before. Deficit Reduction Act before, limitations in, cutting of funding. There's always been the access issue of creating barriers to people receiving healthcare or having healthcare access. Redetermination is nothing new. One time it was almost quarterly, not every 6 months. So thinking about what has happened in the past, when we think about looking boldly, what does that look like for your practice and your organization in this sector today?
I think for Ultimate specifically, leading boldly, from a provider perspective, because we are providers and our doctors do provide healthcare, is meeting with our patients where they're at. And that means a lot of things. And I'll give you 2 examples. So, last year, immigration raids started, and they were affecting and disrupting communities in many ways. And one of those ways was access to care. And so our providers saw a noticeable impact in no-shows or cancellations. And through a provider-driven effort, we started to make sure that we've always had telehealth services, but not all of our patients knew. And so how do we make sure that for those whom want to, regardless of why, never ask why, telehealth is available to you? And that's one way of leading boldly through a small action. Now, unfortunately, you can't do root canals through telehealth, or not that I know of. And so one of the things that we saw for our dental practice, in particular for our pediatricians, our PEDS program, is that in order for a child to receive dental care at Ultimate, you have to come with a parent. And so again, our providers flagged that for our clinic operations. And so we created a system working through our attorneys to ensure that there is a legal guardian or someone designated by the parent to be able to have the child come to Ultimate to receive the dental health services that they need. And so these are 2 different ways that, our providers are trying to meet patients where they're at. At the policy level, because we also lead in policy, it's holding our friends accountable, and sometimes that's hard, but it is important. And being creative and celebrating the little victories, and it is hard in this environment because it is a culture of pain and fear and uncertainty. But when I met with our dental team, unfortunately, for the UIS population, they will be losing access to dental coverage in July. And understandably so, they were very upset. And I reminded them that the cut was supposed to go on January 1st. Now, it doesn't console anyone because the loss is still there, right? July is still going, but we have 6 months to make the most that we can to make sure that for patients who have Medi-Cal, who are UIS, before they lose that service, that they have access to Ultimate, that they schedule their dental appointments. And so by advocating and pleading a delay with the state legislature, we're able to offer dental just for a little bit longer. And so those are just, again, 2 examples in a very hard environment to try to find something to celebrate with. But it creates movement, and for those people, it is very meaningful.
Yeah, same question, please.
So, as I think about this, I'm thinking about the fact that we are fortunate enough to have a membership-driven organization. So we meet with our members quite often. And just to give you a big high-level view, with the arrests and detentions, we are working with about 1,000 families in LA County alone, and we meet with our families weekly. Not only to just give them an overview of what's happening with the immigration system, because a lot of folks are still don't understand, right, all the different components. I'm going to my court appointments. Why did my cousin get arrested, right? And so we try to really work with our families, and we're able to hear the most pressing needs, and we're able to understand how these different systems are impacting them. And so I think one thing that we've done that I think has been really sort of out of the box thinking or non-traditional for us on a certain level is we are having our members of Congress, our local policymakers, and our state representatives meet with these families directly. Not only are they meeting with them, but they're meeting with them in their homes to understand how these arrests and detentions and family separations are impacting them, but what are the other ways that they're being impacted? So they're hearing directly from our clients with regards to losing Medi-Cal, for example, or what these cuts are going to mean for them and their family. So we are trying to make sure that we continue to develop leadership, that we continue to update our policymakers in terms of what's happening, and we're able to uplift those stories when we advocate for these programs to not be cut, right, in Sacramento or in places like in DC. And so I think that's one thing that we're doing to ensure that members of Congress, our local policymakers, and our state representatives really know what the impacts are. Because believe it or not, they don't know the impacts. We were really surprised back in, I'm going to say March or April, when we were meeting with certain members of Congress, had no idea what was happening with regards to the raids, how people were being impacted. And so meeting with them directly, having them meet with our families, we saw a huge transition happen because once they went back to DC, these are some of the biggest, most outspoken members of Congress speaking out against what's happening. And so it's really looking at ways to not only have our community lead in this moment, have their voices be uplifted, but also push our policymakers, push them to become leaders and to really understand these issues and to understand that, folks in our communities don't live single issue lives. They're very intersectional, right? And so really understanding how all of these policies combined really impact an individual or their family is really critically important to move the needle and to continue to lead bold on these issues.
Krista, yes, please.
So I think there's a lot to leading boldly, but one thing I think about a lot in terms of this conversation is there's so much noise out there that's being thrown at us, and there is so much uncertainty. And what we've really tried to do as a leadership team at Planned Parenthood is to focus on our mission and who we serve and why we're here. And so for us, we sort of have this guiding question, this guiding principle: if we don't do it, who will? And that has really grounded us in this moment. We were faced with the defund. We could have avoided it. If we stopped providing abortion, then the defund would not apply to us. And so that was a hard leadership test for us. Stop providing abortion and retain 90% of our revenue for the 90+% of services we provide. Or continue to provide abortion and risk not getting funded any longer. But we looked at it and said, well, that's our mission. And if we don't do it, who will? And we looked out in the community, and the answer to that was nobody. Nobody would provide it 7 days a week like we do, and at the high level of quality as we do. And so we kept doing it, and we took that risk. And so the other part of that, in terms of leading boldly, is not being stupid too. I mean, we did that because we also, the other part about decision making is, gathering your information, seeing what was possible. And so we sat down and thought, okay, well, we know we're going to be going to the state. We have advocacy efforts. There was a whole line of things that we were going to be doing to try and protect ourselves. Another example of that for us is the majority of what we do is provide contraception. And again, we're not getting paid for that right now. So we did have an option. we pride ourselves on the fact that patients walk in our doors and they leave with birth control. We don't have to, give them a prescription like most of us get when we go to the doctor. We get a prescription, we go out to an outside pharmacy. But our patients don't need to do that. And for our patients, we're talking about health equity. They have transportation issues, childcare issues, multiple jobs. It's very difficult. And the idea that they would come to us, then be able to go, especially like an IUD, will come to us, get your prescription, go to the pharmacy, pick up your IUD, and come back. That turns one visit into 3 visits. That's not practical. And the reality is our patients are not going to get that care then. And so again, we sat down and asked, well, if we don't do it, who will? And we were able to sit down and say, okay, for right now, we have the funds to be able to provide contraception directly and not provide prescriptions. Right now, we can do it. But we're going to revisit this. So we're making this decision today because we can. This is the information we have right now. And then we're going to revisit it in 3 months. And we're going to revisit it again 3 months later. And that to me is really important in leading boldly and knowing that you don't have all the answers long term, in the moment, but you have enough information to make a decision for that moment.
Thank you. What sort of practical strategies, guardrails, or approaches have you both found effective in advancing health equity while navigating the legal, the financial, and the political boundaries that you find both the organizations in on different? So, Jeanette?
Yeah. So I'll just give you an example. We received a call on Labor Day weekend, on the Saturday, Labor Day weekend. I was having breakfast with my husband and I received a call from our Rapid Response Network saying that there was a patient at Harborview Medical Center in Torrance. And this was an individual who had been injured during a raid and ICE had him in detention inside the hospital. And his family couldn't find him, but there was a provider that somehow was able to contact our Rapid Response Network and asked us to see what we can do. And so we immediately just pulled together as many people as we could. I called everybody I knew that did healthcare law, because I'm not a healthcare attorney, but just really try to think through, like, how do we get to this patient? What's going to work? And so we met at a Starbucks at 6 p.m. Across the street from the hospital and determined that we needed to go in with a couple of immigration attorneys, a couple of interpreters, and some clergy. And lo and behold, we were able to pull a team together, and then we brought labor. We brought like 10 or 15 folks from SCIU, United Healthcare Workers, and we descended upon the hospital to figure out, to try to get into this gentleman's hospital room. And so I think at that moment, I wasn't thinking about guardrails or strategies. I was just thinking, how do we get this individual some help? Because this cannot be happening at a hospital that was a county-run hospital. And so, there's moments where you just don't have time to think about what are those guardrails, or we did have time to think about the strategy, but we didn't have time to really think about the guardrails. But we had to be really bold in that moment and really think, how are we going to assist this individual? And so, and we're operating in uncharted territory, right? Who knew a year ago that ICE would be bringing in patients into a hospital and holding them in civil arrest? And remember, these are civil arrests inside a hospital, and the hospital didn't know what to do. And so we had to navigate the legal piece. We also had to navigate the healthcare piece with this gentleman's healthcare team. And then there was a Medi-Cal issue too that I'll just highlight. The gentleman had something happen with his Medi-Cal coverage. He was undocumented. And the hospital refused to give us a copy of his medical record so we could help fix the Medi-Cal issue. And their excuse was at that moment that, ICE is going to take care of his hospital bill, so it doesn't matter. And we're like, no, it does matter, because when he gets released, he's going to need an aftercare plan. And if he doesn't have Medi-Cal, how is he going to have that plan in place? And so I highlight this example because sometimes we just don't have all the guardrails in place. We don't have the strategy, but we ourselves have to figure out, how we can help an individual in this really upside down world that we're living in, where there are no protocols. The hospital didn't know what to do. The hospital actually was asking us what they should do in this situation. And we kept telling them, we could advise you or tell you more or less what you can do, but you really do need to have your own legal counsel to advise you that you shouldn't be coming to us. And so, this is just an example of how there are structures in place that we just are, like, again, are uncharted territory, but all of us together need to work in order to ensure not only that there's justice served, but that this individual was getting the medical care that he needed, and that we push back against this administration. And I realize that this is a really scary situation for healthcare clinics and hospitals, but we can't succumb to the pressure of, what does my risk management team say? It's good to check in with them, but you also have to just understand that you also have to just go in 10 toes down and figure out what the strategy is going to be, because we are seeing people in really dire situations at this given moment in time.
Thank you for sharing that, Janet. I think it is a challenging environment for us, and I'm sure my colleagues can relate. Every other day there's an executive order, and is it going into effect? Is it a comment period? All of the analyses, right? A grant is always canceled, on like the third Tuesday in the middle of the night, and you find out through the press. And, that has real impacts, not only for the people that we serve, but also for our colleagues who are working on those grants and providing those health care services. And so it's a very daunting task, and it's a very overwhelming one. I think for me, when I always tell myself, take things into small bites, right? If I think about the system as a whole, I get overwhelmed so quickly. HR1 was, over 1,000 pages, but it is overwhelming, and that's going to create even millions of pages in regulations. And so I always try to take it into small bites, right? And so, two quick examples that were really pertinent to us that were hurtful. So the first is, there's a healthcare workforce shortage. We don't have enough doctors to treat all of the patients that need to have the care. And so at Altamed, we work through the legislature, and there's a Mexico Physicians Pilot Program that we work with. And so we have physicians from Mexico who come to the United States to provide healthcare in underserved, under-resourced communities. Well, there was a visa that we paid, and it was $100. So this year we were supposed to bring in, 12 doctors, so $1,200 to serve communities in Orange County and in the facilities that we have in Los Angeles. Well, again, on an evening, there was an executive order that changed that fee from $100 to $100,000. That is $1,200 to $1.2 million to bring doctors to take care of people. And that is a significant economic burden. We at Altamed, we're a nonprofit. We are a community healthcare center. We serve everybody regardless of their ability to pay. And so not having these doctors is going to create an issue. And so, sometimes it's building consensus. And sometimes that consensus requires reaching out to individuals where you disagree 99.9% of the time, but that 0.001, there's a match, right? And so we were able to sort of cobble together a coalition of the willing. There is a bill in Congress. The fee is still in place, but there is a bill in Congress, and that we're hopeful that, with advocacy and public sentiment, we'll be able to overturn that. And then the second piece is public sentiment, right? I can tell you how, data is important, and having a legal record, and, especially for APA and all sorts of things, on how we win litigation and et cetera. But public sentiment is everything. When the current administration canceled millions of dollars in behavioral health care grants across the country, from Appalachia all the way to California, the public said no. Didn't matter whether you were Republican or independent or Green Party or Democrat and all the shades of blue and red that there is in between, right? They said, this is wrong. I'd never seen anything like that. Within 24 hours, Secretary Kennedy said, just kidding. Your grant funding is back. And so I think, we have to recognize that we have agency. And again, those battles are coming together, and the tactics are not always shiny and fancy, but they do work.
Goes to all of you. And going back to all of you have shared some sort of story and or action or things that your organizations have done and how you've reacted. When you all consider bold equity actions, what goes through your mind in terms of what risks or fears influence your decisions? And then what sort of scale do you use to weigh what has more importance over the other before you make? So I'll start with you, Krista.
So unfortunately, this is one of those things where there is no perfect answer because every decision is unique, and every environment is unique as well. So, I think for us as an organization, I think about like political risks. Legal, so we're talking like legal risk, regulatory, political, how do we weigh that? I wish there was a really easy way to prioritize those, but again, it's all unique. So for some organizations and some of our partnerships, for example, the political risk of maybe like working with us or giving us grants during this defund was too great for them, right? And I completely understand that. When it comes to political risk for Planned Parenthood, we're like, bring it. I mean, we just have a bullseye on us. And so, we got defunded for a service that we never even got funded for to begin with. So that is when I'm weighing risk, sometimes the political risk is low on it because we're already, politically targeted. On the flip side, though, legal risk. We always take legal risk very, very seriously. There's an attorney sitting next to me, so I have to have a disclaimer there. But I do think that when I worked at UCI, sometimes it could have a little more leeway, like, oh, I'll ask for forgiveness later. I can't do that because there are so many people and organizations out there. There are organizations that exist just to take Planned Parenthood down. That is why they exist. So we have to be ultra careful about everything that we do. We don't want to put our partners at risk for working with us, for example. So those are so everything is going to be an individual sort of risk assessment, depending on what the decision is, depending on the organization, depending on who you're working with, and all of that. So all I can say is you just have to take each thing with a unique lens on it.
Janet?
So I would say similar. There's no right or wrong answer. But I would say that there are several organizations that have a big target on their back, right? Cheerlead being one of them, so I can't talk too much about that. But so we also have to be really careful in terms of not only legal risk, but political risks as well. And it just depends on the issue. I think it really does depend on sort of what issue you're dealing with or what strategy you are thinking of employing. But I think, for Chirla, like I mentioned earlier, in spite of being the target of so many different hearings or conversations that they're having in DC, and in terms of having our, we do have a target on our back, I do think that it's important to not only look at the legal risks as well as the political risks. So for us, for example, we've been asked to lead on certain issues, and I've made the determination, like, maybe not Chirla right now, right? Maybe we're not the right one, but we could do the technical assistance on the back end. And so just navigating sort of how do we still weigh in and take bold action, but maybe mitigating what a partnership with us may lead to for another organization or even for a legislator, right? I've had to make those political calculations. And I think in terms of our work, I don't think we've backed down in terms of being upfront and leading and making sure that our membership's needs are being addressed and that we're giving them a voice, right? Especially in this moment in time when we're seeing just so much cruelty waged on so many levels. We just had another death happen in Adelanto yesterday. I just met with a family who lost their dad 2 weeks ago in their small one-bedroom apartment in Westlake Village. And I don't know if you all are familiar with LA, but it's a really densely populated part of Los Angeles where poverty is rampant all over the place. And it was really sad to visit the home because they brought the dad's provisions that he had while he was in detention. And it was just sad to see them across the table. So when we're dealing with so much tragedy, when we're dealing with so much loss, when we're dealing with so much heartbreak, I think that just behooves us, right, to continue to fight, to continue to give those individuals who do not have a voice or a say to have that voice and a say at this moment. So we do continue to lead, but again, we do make those calculations as well, because I would love to lead on every issue, but I know that Chirla is not the right spokesperson at this moment in time. And then obviously, we do have to consider the legal risks or what we're able to say, right? And so we do work closely with our legal team and make sure that we have a crisis comms team as well at this moment, right? Because there's just so much happening it's like that movie Every Day or Every Day All at Once. I mean, what was it called? Everything, Everywhere, All at Once. That's what it feels like to be in my position right now, or the organization that we're in, because we do get those emails at like 10 o'clock at night that a funding got cut, or there's this new policy that's happening, or this is now going to impact one of our impact litigation cases that we have against the federal government. So it's constant risk assessment, but also grateful that I work for an organization where we have made the decision to continue to fight and not back down.
Okay, I guess it's my turn. So I think, so I like what Janet said and Krista about sort of like the messenger and the fight. And so I'm not married, but I have the best marriage advice. I heard this once and it just stuck with me forever. And it was that the secret to marriage is not fighting, it's knowing how to fight. And so for me, that's kind of how I try to approach my work. I had the privilege of working for Congressmember Raul Grijalva from Arizona. He was the chair of the Progressive Caucus. And, him and John Lewis were getting arrested everywhere all the time. It didn't matter if it was Obama or Trump in office, they were chained to the White House, right? And that was their way of fighting back and trying to create a fair and more just system. But, when we were talking about bold leadership and what does that look like and how do you create change, in particular in this environment, the voice of Ultimate might not always convince, Dr. Oz at CMS, for example, to take a particular position. And so this is where we have to think through our network and our relationships and who is going to be the strongest voice, who is going to be able to carry that message and to be able to protect, the small gains that we have, right? And so I try to tell that to my colleagues because, they're used to, going to the rallies and getting arrested. And I think that there is beauty in that, and that does change and creates public discourse and leads to many of the gains that we have. But we have to do that and more, and figuring out, the political risk, the financial risk, especially, we as a community healthcare center are heavily regulated, as Krista knows, from the federal government, and our charter is given to us by HHS, right? And so although we are fighting differently, the one thing that never changes is our mandate. We were born out of the civil rights movement, and our mission is to dismantle healthcare disparities and to give people quality care without exception. And so we do that without compromise. How we do it will look a little bit different sometimes.
Thank you for sharing that. This next question I have just for Krista, and it is, what systemic institutional obstacles most get in the way of bold equity action, and how do you move forward despite them?
We have no institutional obstacles, do we, ladies? I think, so I've been talking a lot about the sort of external obstacles, and I think you're asking about sort of internally, yes. Right? Change is hard for everybody, and we are living in extremely uncertain times, and you can imagine in our organization, as a direct result of the defund, we had to close our primary care program in December. So again, you talked about leadership, so I came into this position July 1st. We were defunded July 4th, and in October I had to announce to our staff that we were closing our 12-year Melody Health primary care program and laying off 81 staff members. It's not what they tell you in MBA programs on what to do in your first 90 days. So we're just constantly, as I said, sort of talking about really doing a lot of reflection. But I think the obstacles are getting through how, as a team, we we work through uncertainty, we accept that there is uncertainty, that there are not clear answers, that the decisions that we're making today may look very different 3 months or 6 months or 9 months from now. And that can be hard on folks. I mean, people will say, but a few months ago you made this decision. And what I try and really think about is being consistent in how we approach decision making. But even though then the decision outcome might be different because it's based on new information, it's based on on what's happening in that moment. So I think change management, really trying to lead people through change management, understanding that it is hard, and having grace for folks, being able to just pause. That's a lot of, you were talking about that at the beginning, Ryan, that sometimes leadership is not just go, 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 we're just going to keep blowing things up, but we just actually need to focus on stability. And when we were starting this year off after getting defunded, we really started off with a survive to thrive. And so what are we going to do this year? What was that roadmap for what we were going to look like as an organization this year with all of these pressures that are coming at us? But what was it that we can accomplish? And I heard you say, think about the small successes and the progress, and that is really important. We have to think about what we are still able to do. We are still open 7 days a week. We are still serving patients. Even though, there's some changes that we've had to make.
Thank you. I think about something that I think we as an organization, and like many of you have also learned during this time, has been, as things were coming at us, like just a flurry thing, one after another, you feel like, you were getting knocked down you get back up, you get knocked back down. And I think one thing that we learned pretty quickly was that, not every time do you have to react to something. So it's also about being very mindful of how you then respond, but not necessarily always react. And so, again, I think to that point of either whether it be the pause or something to that degree, it's also about taking the time to kind of just think. And it's okay to say, I don't know, and I need to figure this out, and pull together a team and or a group of individuals to help you kind of work that out. And as we think about some of those things that you have all done, and you mentioned taking stock of those small wins and how we should celebrate that. I think as we look at this space, what defines success, I think it looks different for every organization and for every response to that degree. So when you think about that, how do you guys measure that success? And what does that look like? And how do you celebrate that? I'll start with you, B.
Thanks. Oh man. So I think for us, sort of like at the macro level, what success looks like, it's health outcomes, right? That's how you define, how do you close health disparities and have health equity? And it's looking at a population and who has the healthiest health outcomes and who doesn't. And over the course of, the year or the 10 years, are those closing, right? And so I think that, for us as a provider, that is a key element of defining success. Are patients healthier? Are they living longer? Are they living with dignity and aging in dignity, right? And so I think that, those things are important. I think that, at the sort of micro level, it's anything. I make my bed every day and I think, check, I got to win. Sometimes you have to make fake wins, honestly, to just get through the day. And it's like, this is the one thing I can control. Like, I can't control anything else, but I can control making my bed. And so that just, gives me like a, star on my calendar. So, I try to do that.
I think that's a complicated question just because for us, we are a membership-driven organization. So I think on the macro level, again, just understanding the needs of our community and really giving them a voice. And at the macro level, just really thinking about the bigger wins. So we do have legislation that we passed. Last year, we passed SB 805, which is the No Vigilantes Act, which is the bill that requires everyone, local, state, and federal law enforcement, to identify themselves and wear uniform that corresponds to the agency they work for. So that bill and the anti-masking bill were immediately challenged by the Trump administration, and the district court found the anti-masking bill was unconstitutional, so it enjoined that one, but ours survived the challenge. And so those for us felt like a small win, but it was a huge win, right? Because this is model legislations that can be replicated in other jurisdictions and other states. And so just thinking about how we can push the envelope at the national level of some of the wins that we have here in California. And I will say, and the small wins matter, right? One of the wins that we also had was me and my other litigation attorney went and visited a woman in Adelanto to ask her about the conditions in the detention center, and she had an asylum claim. And we were able to refer her to our legal department. They were able to represent her, and we just met with her the other day in person. She's now out of detention. And that took us 6 months to get her out, but those small wins, give us life to continue to do this work. And I will say I'm pretty even keeled and I don't get really emotional about the work, but there are moments where I just can't hold it back. And so, and that's a win too for me, because I feel, so I'm the youngest, but everyone thinks I'm the oldest because I always had to keep my family together. I was the interpreter for my mom, going to the bank, to the doctor, everything. And so I always had to keep my stuff tight, right, and in order. And so even when I cry, I feel or when I get emotional about what's happening, I consider that a win, because it just demonstrates that yes, we can be resilient leaders, but we also need to be in touch with our emotions and really understand how the humanity and the dignity of the people we care about the most is really being compromised at this moment, and is completely unacceptable. And it's okay to be sad about that. So I consider those moments where I really do feel it on a different level as a win.
Ryan, you didn't realize this, but you have an oldest, youngest, and middle child rounding out this panel. So that's why it's successful. Yeah, I think that every organization, obviously, the metrics are different and unique to that organization. For us, we are very clear about our mission and access, and so we have for years had goals that we have, even during all of this, have not walked away from. We're open. We have all of our health centers, or nearly all of our health centers, are open 7 days a week. We have 15-minute wait times, and we see patients in and out the door in less than an hour is the goal. I know. If you come to Planned Parenthood for your reproductive health needs, you'll be out in less than an hour. It's actually 50 minutes. And we have same day or next day access in both counties. And so that is a metric that we have been measuring. And so it's been important to us to continue to measure at that, because that really gets to our mission for us. And then we've got really high Yelp reviews. And so really holding ourselves to that high standard. And then internally, I think there's internal metrics too in terms of how we are functioning as an organization. We did, like I said, we set out goals at the beginning of the year, because we felt, especially in this really tumultuous year, it was really important that all of our staff sort of knew, besides just our mission, but what is it that we're working towards, and that everyone on the team is working towards at least one of our goals. So whether it was advocacy or fundraising, or we're starting an online appointments with, like, it's 2026, we're finally getting with the time so patients can schedule their appointments online. That's something we've been trying to do for a couple years, and it kept getting pushed down. And we thought, this year it was really important for us to do it, because again, it's a win. It's a win for our staff who have been really wanting to do this and being able to serve our patients in that way. We didn't want to just be feeling like, well, we're defunded, and so it's just, just the basics. No, we're just going to keep striving. One of our goals is to be best in class, be the best Planned Parenthood in the country, and so we're still, striving for that. And that, I think, has been, a morale booster for staff to feel like. So this is why I bring them, because they just nod, right? But I think, yeah. But I think that it's been really great for staff to still feel like that we're able to show up for our patients in this moment.
Thank you. So given everything that we've discussed, we're getting down to our last couple questions, and something for the audience to take back with them. what's one action or mindset or commitment you would encourage the attendees to take back to their organizations to think about how they would advance health equity more boldly within their institutions or in their everyday lives? Start with B.
Thanks. I'm going to bring it down back to like small bites, right? So the one thing that you have to know about the freeze on Medicaid for UIS patients. So for individuals who are mostly undocumented, who have Medi-Cal, and for other lawfully present people, the state enacted a Medicaid freeze starting January 1st. So what it is and what it's not. People do not lose their coverage. So if you had Medi-Cal December 31st of 2025, you have coverage. So if you know folks, don't go asking people for their immigration status, but if you know people who are asking about the changes, no, you do not lose Medi-Cal. And so I think that's going to be really important because I think some people are confused about what that change is. And so they continue to have it. The second thing is that there are exceptions. So for children who are undocumented or UIS, you could still enroll in Medi-Cal. So that's going to be really important in making sure families are aware. Please continue to enroll. That is available to you and nothing changes. If you're an adult and you become pregnant, you become eligible for Medi-Cal during your pregnancy in the 9 months. And so if there's the one thing that I can leave you with is please learn about the January 1st freeze. It is a freeze on enrollment. It is not a freeze on using your Medi-Cal if you have it and if you are part of the UIS population.
So I'm going to go a different route. I'm not going to go specifically into healthcare. I'm going to just give you these parting words. I think, I would, again, encourage you to sort of lean into this moment and what we're facing right now and just be the best advocate you can for whatever situation you're in. Really lean into the situation as well, but also don't for a minute think that you're not prepared to handle what is being thrown at you or what you're seeing or what scenario you're walking into, right? I truly believe, especially as women of color in these spaces, that we're often we're not pushed, right, to work outside of our comfort zone. And I think this is a moment where you just have to be uncomfortable in the uncertainty and really understand that you are a leader in this space and that you are prepared, that everything you did prepared you for this moment. Because I truly believe that. I think this is such a difficult moment for all of us combined, but really just want to push folks to think about how everything that you've done has somehow prepared you for this moment to lead and to lead boldly.
I'll add to that. We're talking about how change is really hard. However, we are also extremely nimble and flexible, and we survived the pandemic as organizations and as people, sort of that whole change and lifestyle and all of that. And it really, I think from that, we learned that we can really push ourselves and push our organizations and do things that, we used to say we would put off because it would take so long, but we had to do things overnight in a lot of ways. And we're in a similar moment now where there's a lot of uncertainty and a lot of pressures coming. And so I think just continue, in terms of being bold, like I said, at our organization, we're sort of taking that mantra of if we don't do it, who will? Find something similar for yourself and for your organization that fits and that really motivates you and your team and really speaks to the work that you're doing, I think is really important. And, the other thing that I have said, anyone who works with me knows I always say, let's not get in our own way. So sometimes we get stuck on, policies. We've never done things that way. Who cares, right? Like the most important thing is what's the outcome that we're looking for, and then let's just figure out a path to that, and let's not be the ones to get in our own way. We've got enough external stressors and pressures on us that make our lives and our work really difficult. So let's not be the ones that are standing in our own way as well.
Great piece of advice. And my last question is for B. And this is the only question she wanted me to ask her, by the way. It's how do you recharge or find respite from leading boldly?
Thanks, Ryan. I was supposed to skip all the other questions.
I know, exactly. But I know you also don't relax, so that's why it's kind of funny to ask you this question.
Yeah, I do not relax. So As someone that was born in the 1900s, I would say that I did not have boundaries. And so if it was 9 p.m. and my boss said I needed a press release, I was at the computer doing the press release. I was bi-coastal, so sometimes when I was in California, my staff would call me at 6 a.m. their time, 3 in the morning California time, and I would answer. And so I think, as I matured and started to become, older and finding my voice, it started to set boundaries and really protecting my time and saying, sir, after 7 p.m. on a Friday, don't call me unless, the world is kind of burning, then yes, feel free to call me. And so I do think it's important, whatever your boundaries are, sometimes it's, time, sometimes it's other things, like it is important to protect them and have you time. Thanks, Ryan.
You're welcome. Thank you. I like that answer. Oh, now we're going to open it up to the audience for questions. Jonathan is going to roam the room and has the microphone, so please raise your hand if you'd like to ask our expert panel a question.
Hello. Okay. So my name is Britt. My pronouns are they, them, and I'm going to preface my question with a little bit of contextual information. So in the last 8 months, 3,000 patients, 3,000 trans and non-binary patients have lost access to their medical care, and 2,000 additional trans and non-binary patients under the age of 19 have access to health care in limbo as a result of a lawsuit with CHOC, also Radies, trying to discontinue access to their medical care. An unknown number of patients are experiencing discrimination as local hospitals are turning them away because they are fearful of losing federal funding for providing care to trans and non-binary patients. So my question is, what have your respective organizations done to continue to ensure equitable access to gender-affirming care for trans and non-binary patients under the age of 19? And what do you have mechanisms in place to ensure that they have folks that are helping them with navigating this current political climate and ensuring that they have the care that they deserve that is also legally protected and essential here in the state of California?
I can start that one. That's a really critical issue. Thank you for asking that question. At our affiliate, providing care to trans patients was part of our primary care program, which unfortunately we had to close in October. I am really happy, though, that we've been able to continue to provide it in San Bernardino County. We have a provider that's in San Bernardino County. In Orange County, fortunately, when we were working with the coalition on reassigning our patients to other providers, all of our Melody Health patients, we were able to find other providers. I don't know specifically who they were, but I know that I was told that we do have providers that we transferred those patients to in Orange County, and in San Bernardino we're continuing to. Not for patients under 19, though.
So, for us as a federally qualified community healthcare center, we have to provide access to care to everyone, regardless of their ability to pay or their personal circumstances. And I think two things, and I'm going to wear my former hat. So, when I was at HHS under the leadership of Secretary Becerra, I was especially proud that at the time he worked with the Trevor Project to institute a 988 crisis lifeline for trans individuals. It was so important, in particular for individuals that needed assistance as they were navigating mental health crises and making sure that it was relevant to their personal circumstances. And it was individuals that could relate and to provide the care. Unfortunately, the current administration has dismantled that support, and is really unfortunate. I think any person, regardless of who they are, should have access to healthcare. They should have access to mental support in the times that they need them the most, and someone who understands and can relate to their experience, at the time of crisis. And so, I would say that, for us, we were recently targeted by Republicans, and this is in the public sphere, right? And trying to pressure us to deny care to certain populations, and they did not change how we approach the work that we do at all whatsoever. So thank you for your question.
But I would like to actually ask all of y'all, now the times right now are difficult, and I think it's very inspiring to see you all and everybody in this room kind of stepping up. I do want to say, hopefully in the next couple of years, there might be an administration change or public, visual change. What lessons do you think we have to take out of this period or in the work that you're doing that maybe that will come in useful in the future? So I think in the past, similar to what somebody said about, we used to limit ourselves, like, oh, were these things politically feasible? Was this, are these things possible? Well, now we see that anything's possible if you try hard enough, apparently. So I just want to hear, like, what brings you hope, or what do you think that we can achieve in the future, knowing that some of these, barriers aren't exactly barriers anymore?
I'll start us off. I think one thing that I would say is I feel that this moment, given so much leveled attacks against immigrants, that immigration lawyers will probably go down in history as the primary defenders of our Constitution at this given moment in time. But we can't do it by ourselves, right? The immigrant rights movement cannot do this by ourselves. And like I said, our lives are not single issue; they're very intersectional. And so I think for us, what's been exciting to see is sort of how we're building this big tent approach, right? Building this bigger tent. What other social movements could work with us? What other sectors of our society we could work with? So we're working more intentionally. We've always worked with labor, but right now we lead an immigrant and labor leader table in LA where we meet every 2 weeks. We convened organizations across the state as part of our California table, also meeting with them on a monthly basis, updating them how you can be involved, how we can all advocate together. And so I think this moment is teaching us a couple of things, right? One, we can't let the other side out-organize us. We got to be really cogent in organizing our communities and our base. And we also have to build a bigger tent because we can't fight against all of these attacks single-handedly. We need everybody to be involved in this fight for democracy. And it's bigger than what's happening, I would say, in healthcare and immigrant rights, in all of these different issue areas. It's really a fight for democracy. And so we really need to start working outside of and we've all heard this before, right? So working outside of our silos, and also just looking back at what social movements were successful and what lessons we could draw from them as well.
I think, I would say, if you think our healthcare system is fair, raise your hand. No one, right? And it hurts because we see a lot of things being decimated. And again, I don't know, you guys are really bringing the optimist that I guess lived really deep down inside of me. But I do see this moment as, in certain ways, it feels like, key victories or things are being burnt down. But I do think that it gives us an opportunity to create and to rebuild in a way that is going to be more equitable. I used to, my boss, Jimmy would always say, Congressman Gomez would say, it's equity by design, right? So you can talk about healthcare equity, and usually people think about it at the back end. The program's already built, and then at the back end, it's like, oh, well, say, 10% of those funds will go to like distressed communities or underserved, or et cetera. But it really gives us an opportunity to do an autopsy of everything that has been undone, and how did the design fail people? And there is going to be an opportunity that is politically ripe, that, the public is there, and how do we create the system that can, uphold, a better healthcare system? And again, I talk about healthcare because that's what we do. And so I think that's the way that I would look at it. We have a system that's fundamentally flawed, that's being dismantled. How do we sort of go big and create the conditions to allow for them to be enacted in the future?
Yeah, I would say that hope is extremely powerful. And hope is not optimism. I can be maybe too optimistic sometimes. But I don't see hope as optimism per se. I mean, hope, people say hope is not a strategy, but I think that embedded in hope, when we have hope in this moment, it actually does include a strategy for knowing that we can get out of whatever pickle we're in, and we can get to the other side. And so I think a lot about how one thing I've observed in all of this, there has been a tremendous amount of public support for fighting, what we're all dealing with. But a lot of people really just, until it impacts them, they don't really understand it. I'm not going to say they don't care, but they don't maybe necessarily understand it. And what we're finding is that so much of what's going on is impacting most people in some way. And so I think as we continue to have progress and fight for things to turn around, we have to remember that as meeting people where they're at and what in this moment is happening, whether it's immigration or losing their health care, losing access to care for an ectopic pregnancy in Texas to save your life. You yourself would never choose to have an abortion, but you have a pregnancy where it's endangering your life and you go to a hospital and they won't treat you. And now suddenly that impacts you, impacts your whole family. And people are like, oh, that Dobbs decision was actually kind of really important. And so we're seeing that for so many things. And I think that's a reminder is to really meet people where they're at and where their needs are and what's impacting them and ask them to join the train and come along and help change the world.
Hello. As I'm a public school educator, so I know I'm in a little bit of a different field than most here. I teach elementary students, I teach music, and I see what happens to a lot of my students in the area where I work, where most of my students are almost 90% are part of that underserved community. And when all of the information about ice raids broke out, about maybe a third of my class showed up and half of them were at home too terrified to leave. Seeing so many people working at such a higher level to fight for my students is one of the best things to see. But as someone who is in my position where maybe my voice isn't as loud as some of the others in the room, what can I do to help in this situation, to lead boldly in that way, and just practical things that maybe I can do in my position as a normal person to help in this situation?
I think teachers are playing such a critical role right now. We're working with UTLA, and one thing they did this year, at the beginning of school year, is to have community members adopt schools, right, to help us patrol schools, making sure that drop off and pick up are safe, and we could try to mitigate, right, immigration enforcement in several parts of LA County. And I just think just standing up for your students, just fighting for them, understanding what they're going through. We also work with childcare workers, and they have been telling us, right, that they're seeing ADHD, depression, all types of things in PTSD in children and toddlers as young as 1.5, because our communities are really under siege and living in warlike conditions. And so any service that you could identify for your students, any way you could support them, shoulder their burdens, whatever you can do. I think teachers are playing a critically important role right now for our communities. They're also the bridge, right, for our kids and their family members to access other services. So anything that you can do, I think, is heroic and is helping at this moment, because the most difficult part of this is seeing how families are being separated, how they're being impacted, but also how isolating this is, right? Many kids aren't going to school because their parents are too afraid to walk them or drive them to school. So any way that you can connect with that student, any way that you could, again, offer any type of supportive services, I think is so important at this moment, because otherwise our families are really left in isolation.
Just add to that, you're here, right, on a Friday. Did you teach today? You did, and you came here, right? And so this is important to you. I can see that. And I think that, showing up to your classroom with your students every day is, first of all, you radiate light, honestly, doesn't she? So just a beacon for your students who are going through all of that. And then you're seeking out information, right? And so that's really key as well. And, I think you can make a connection with Jeanette here and with others, and so that there are other resources. And it's everybody showing up in the way that they can and in the place that they are that really makes a difference.
Thank you for that. Is there maybe one more question? I think we have time for one more. If not, we can close. Great. So as we kind of get to the end of our conversation tonight, make it very clear that we've heard a lot of, maybe not so much of a differing perspectives amongst our speakers, but I think there is a definite shared commitment to making sure communities are healthy, and how informed decision-making brings us together. I would really want to thank our esteemed panel for sharing with us your thoughts and your ideas, and I think in a lot of ways being vulnerable to what you've all sort of experienced over the past, since this transition and this administration has somewhat chosen to take this different tact. Some of you who don't know, but I'm a big sucker for quotes, and thank you, Sonia, for capturing these for me, because I'm a big believer in creating t-shirts. Just wanted to, as we bring about some key ideas or key thoughts from today in these quotes that you all provided, from choosing being an optimist because the arc of justice, even though it bends, it twists and stretches, it doesn't break. Definite t-shirt. I think, Krista, you mentioned that Planned Parenthood, you chose to focus on your mission, who you serve, and why we're here, and if you don't do it, then who else would? Jeanette, I think your key point that I really captured from today was, the question about the guardrails, you said sometimes there aren't any guardrails, and we just have to act. And I think that's also very timely and appropriate given in the certain situations that we are. I like also the idea of when navigating roles, ask how can we weigh in or assist right now, and really even be sort of that support even when you're not leading, and that's perfectly fine too. B, your quote around the secret is not don't fight, it's know how to fight, I think is very appropriate. And also a key point I think that came through tonight was just boldness, I think is evident in just us standing together. So as we think about that, just really want to thank you all again for your participation and dedication tonight. I do want to bring to your attention one key item. Just want to talk to you something that our health centers and the coalition are actively fighting. You will definitely see a ballot initiative that will appear on November's ballot. It is something that we find would actually divert more than $1.7 million away from patient access and community health centers, impose really arbitrary spending ratios that are just unfounded, and really think about how it imposes a crippling penalty tax on all of our health centers for not adhering to a mandate of sorts. The coalition, along with our statewide association, the California Primary Care Association, as well as our member clinics such as Ultimate, Hurt Family Health Center, and other regional consortium and clinics across the state are trying to build awareness about this bill or this ballot measure and execute really just an effective and comprehensive field effort to really amplify stories as well as build trust, drive engagement, and sustain civic participation in our communities. And lastly, before you all leave, there is on your QR codes on your tables. And so please look at the evaluation to, not that we can pay for your parking, but at least turn in the evaluation for us. It helps us structure and think about what we want to do in the future. We also do have paper versions of the evaluation if that is easier for you as well. We definitely want to make it easier for you to turn this information into us. It really does help and guide us as we think about our next Coffee Connections events that we'll be hosting throughout the rest of the year. I believe our next one is June 5th, I want to say, and topic and location to be decided, but hopefully you can all join us again for that event as well. So with that, again, join me in thanking our esteemed panelist speakers, Krista, Jeanette, and B. Thank you again for your participation and engagement today. Thank you.